the vasculature or the blood supply. So the meninges are very important because the brain weighs, again, as we saw, about a kilogram to 1.4 kilograms, and it has actually the consistency of custard. And so when people pass away and they fix the brain in formalin, they really have to do that so that the brain doesn't kind of get all mushy in order to study it. So because it is so fragile, it has to be encased in a pad. That's a mnemonic for you. And it's a pia mater, arachnoid layer, and the dura mater. And these three layers are called the meninges. And again, the pia mater is the innermost layer, and it's a very thin, delicate, and very capillary-rich layer, and it's attached directly to the brain. And the arachnoid layer is kind of in the middle, and it has thin filamentous connections, kind of like a spider web, and hence the name, the arachnoid layer. And then the dura mater is Latin for tough mother, and it's the outermost layer, and it's very tough and thick to provide the brain an outer protective layer. And that's attached to the skull, whereas the pia mater is attached to the brain. And you can again see the little PAD, it's pia arachnoid dura, for the pad to encase the brain in. Now between the dura mater and the arachnoid layer, we have a narrow subdural space, and that contains a very thin watery fluid that prevents the two layers, the dura and the arachnoid layer, from adhering to each other. And then between the arachnoid layer and the pia mater, we have a relatively large gap. We call that a subarachnoid space, and that's filled with cerebrospinal fluid. So if you hear of a subarachnoid hemorrhage in the brain, then that's referring to bleeding within this space between the pia and the arachnoid, and a subdural bleeding would be between the dura and the arachnoid layer. And as I mentioned, fibrous filaments called arachnoid trabeculations extend from the arachnoid into the pia to help anchor the brain to limit the motion during rapid acceleration and deceleration. And this image is an image of someone in an MRI scanner, and the lattice structure is simply there just to kind of let you see how much the brain moves as the person is moving their head from side to side. And so it's going to be an image of the brain where the person is just simply moving the head to one side and then stopping. And so you can kind of see how much the brain moves within the skull. You see there's a fairly good amount of movement. And that's just moving the head from side to side. Yes?
Would you mind if I really hard to dim the lights on?
Yeah, Jonathan, can you get the lights, please? Okay, we'll try that again. So at that stopping point, you can see the brain kind of wiggle a little bit. Imagine what happens when you sneeze. So again, it's a good thing that we have the dura mater, the pia mater, and the arachnoid layers to encase the brain. Mm-hmm.
Is it bad to hold in your sneeze?
No, well,
I've heard that, I think.
Yeah, I wouldn't hold it in. I think your body's trying to get rid of something. So from that point of view, it probably increases your blood pressure and your intracranial pressure too. So I would recommend letting it all go. And imagine, if you will, somebody who has a concussion, like a football player or just football players in general, or soccer players running up and down the field and things like that. So turning to the ventricular system, the brain and the spinal cord are actually hollow, and the expanded hollow areas within the brain are called ventricles. The walls of each ventricle have inside small structures called the choroid plexus, And it's from the choroid plexus that the cerebrospinal fluid is actually produced. And the cerebrospinal fluid flows from the two largest lateral ventricles through two little holes called intraventricular foramina. And that goes into a single midline third ventricle. And then through a single midline aqueduct, another connecting tube called the aqueduct of Sylvius, into a single midline fourth ventricle, and then out of the brain through three openings in the fourth ventricle. And these are called the one middle foramen of Meninges and the two lateral foramina of Luschka, foramina being the plural of foramen, or opening. So that's kind of the flow of the cerebrospinal fluid. The two largest ventricles are obviously the two lateral ventricles. And I don't know, they don't really have a number, 1 or 2, but they're counted as 2 to give rise then to the third ventricle, which is a single midline area, and then the fourth ventricle, which is also a single midline structure. And outside the brainstem, the cerebrospinal fluid enters the subarachnoid space, and then it exits into the sagittal sinus via what's called the arachnoid villi, or arachnoid granulations. These are just structures that are within the sinus wall to absorb the cerebrospinal fluid. And any obstruction in flow of the cerebrospinal fluid will lead to expansion of not only the lateral ventricles, but all ventricles. The lateral ventricles are really the most prominent, and that leads to a condition called hydrocephalus. The largest area of subarachnoid space is the lumbar cistern, and that's the space between what's called L2 and S1, or the second lumbar vertebrae and the second sacral vertebrae. So there's L3, L4, L5, and S1 in between those two. And that is the usual area for a spinal tap. If people have to take a sample of cerebrospinal fluid, that's really the best place to take the cerebrospinal fluid from. And then below S2 is where a saddle block or epidural anesthesia is administered that is often done in cases of childbirth, for example, or knee or foot surgery. So this is an example of hydrocephalus where there's a massive expansion of the lateral ventricles, and it should look more like that. You can see that the lateral ventricles are relatively small at that particular level. These are kind of the posterior horns of the lateral ventricle in the normal brain. But here you can see that there's excessive production of cerebrospinal fluid, and that also kind of squishes the brain up against the side of the skull. So that's not a very good condition. There's also something in aging, typically in aging, called normal pressure hydrocephalus, which is a disorder of cerebrospinal fluid removal. And so again, within the ventricles, we see the anterior and posterior horns of the lateral ventricles. In this particular image, cerebrospinal fluid is white. And so this is just showing the dilated ventricles in normal pressure hydrocephalus. Sometimes Alzheimer's disease is referred to as hydrocephalus ex vacuo, which basically just means shrinking, or hydrocephalus due to a shrinking brain. And in this particular MRI image, cerebrospinal fluid is white. And the extensive whiteness here just reflects the atrophy of the brain, with the cerebrospinal fluid kind of filling in around the brain. So Alzheimer's disease isn't really a hydrocephalus as compared with what we typically refer to as hydrocephalus or normal pressure hydrocephalus. Yep.
So are the ventricles covered by something such that, for example, if the brain matter for some reason is removed at that region, it's not going to flow out, or is it just freely kind of floating inside the brain, such that if you were to damage the brain, it's going to flow out?
So there is a lining to the ventricles, but sometimes if parts of the brain are taken out, then the cerebrospinal fluid kind of leaks out, but it also, the cerebrospinal fluid goes around the skull as well. So it would just kind of leak out and fill in the spaces, much like it has here, where the brain has been lost and the cerebrospinal fluid is filled in around the atrophied brain. Yeah, please.
Is that to maintain the pressure that should be around the brain?
Yeah, to maintain the pressure and more for protection of the brain in cases of movement. And
so someone who had large portions of their brain removed, they would have
a lot more of
there
cerebrospinal fluid. Yeah, it would just kind of kick in and produce itself. Now turning to the blood supply, in terms of the physiology of the blood supply, there's about 1,000 milliliters of blood per minute going through the brain, and the brain, obviously, we talked about last time, represents only 1/50th of our body weight, but it uses 15 to 20% of our resting cardiac output. And an interruption of blood flow of 6 seconds will cause neuronal metabolism to suffer. So in cases of hemorrhage, for example, or just a loss, a cardiac arrest, for example. 2 minutes of interruption of blood flow to the brain activity ceases, and after 5 minutes, irreversible brain damage begins to develop. Fortunately, there's a lot of autoregulatory systems within the brain that actually maintain a constancy of blood flow to the brain, even under varied conditions, like difficult physiological conditions, like with it being so cold outside. Our brain is still getting the same amount of blood flow as if it was 90 degrees outside. And under various emotional conditions, if we're all revved up and angry versus if we're kind of in a Zen state, both of those conditions, we would still have about the same amount of blood flow being delivered to the brain. Yeah?
Is that also true for someone in a coma?
In a coma, there are certainly the autoregulatory conditions that maintain that homeostasis of the constant blood supply to the brain. Yeah. So amazingly, with all that blood supply that's going to the brain, there's just 2 pairs of arteries that feed into the brain to provide it with the blood that it needs. We have the vertebral arteries, which are more in the posterior part of the skull. They enter the skull through the large opening, or foramen magnum, and they pass along the ventral surface of the medulla. And the vertebral arteries provide the brain with about 1/3 of its total cerebral blood flow. Along the way, it gives off some other little arteries as it goes into the brain, the anterior and posterior spinal arteries for the spinal cord, the posterior inferior cerebellar artery, sometimes abbreviated PICA, and then the vertebral arteries join to form a single basilar artery that passes up to the beginning of the pons, and then about at the level of the pons, the basal artery splits again into 2 posterior cerebral arteries. The internal carotid arteries are the other pair of arteries that enter the skull, and they come in through the carotid canals, and they're just adjacent to the optic chiasm. And they provide 2/3 of the total cerebral blood flow. The carotid arteries, or the internal carotid artery, I should say, splits into an anterior cerebral artery and a middle cerebral artery. And the anterior cerebral artery supplies blood for most of the midline structures of the brain. So it kind of passes forward in the medial longitudinal fissure, that groove between the 2 hemispheres of the brain. And then they kind of sweep back to the parieto-occipital fissure, supplying the medial surface of the hemisphere. The middle cerebral arteries pass laterally through the temporal and the frontal lobes, and they supply the blood for most of the lateral surface of each hemisphere. They emerge at about the lateral or the sylvian fissure, that horizontal fissure. As they pass between the frontal and the temporal lobes, the middle cerebral artery gives off little striate arteries which supply the internal capsule, that very important motor structure, with much of its blood supplies. And it turns out that these striate arteries are the very frequent site of strokes or cerebrovascular accidents. And they're sometimes known as the arteries of stroke because oftentimes following a stroke, people have some very prominent motor problems with usually one side of the body. This is just a diagram of the blood supply of the brain, and we see this is your heart, and gives off your aorta. Off the aorta, we have the common carotid artery. The common carotid artery splits into an external carotid artery and the internal carotid artery. And it's the internal carotid artery that goes up into the brain to split into the anterior and the middle cerebral arteries. You can sort of see how the middle cerebral artery comes off of this internal carotid artery and starts to supply the lateral surface of the brain. The anterior cerebral artery is going up a little further into the midline structures and then sort of coursing back to the parieto-occipital region. Down here we have the vertebral arteries along either side of the spinal cord, which is this thing right here. And you can see about the level of the pons, it becomes a single basilar artery, and then it splits into two posterior cerebral arteries. And so that's more or less the diagram of the arterial blood supply. And this just is showing that the vertebral artery supplies the posterior cerebral artery for about 1/3 of the blood flow of the brain, whereas the internal carotid artery gives rise to the middle cerebral artery and anterior cerebral artery, and supplying about 2/3 of the brain with its blood supply. And this is just another diagram looking at kind of the medial regions that are fed by the anterior cerebral artery and the lateral regions fed by the middle cerebral artery. And this is a coronal section of the brain, kind of showing again the distribution where the anterior cerebral artery feeds more of the midline regions of the cortex, and the middle cerebral artery is kind of more at the on the lateral surface. So the anterior cerebral artery is connected, or the two anterior cerebral arteries actually are connected via the anterior communicating artery, and then the middle cerebral artery and the posterior cerebral artery are linked via the posterior communicating artery. We have an anterior communicating artery and a posterior communicating artery. And these two communicating arteries then kind of seal a ring that is a ring of blood supply between the vertebral and the internal carotid arteries that is called the Circle of Willis, after Thomas Willis, the anatomist that we talked about in the first class. So if one of the arteries becomes occluded, the nice feature of our Circle of Willis is that blood can pass around the occlusion to try to reach the deprived area, thereby providing a little bit of collateral circulation in the event of damage. This area, particularly anterior communicating artery, is a very frequent site of aneurysms or ballooning of blood vessels that can sometimes rupture. I actually had one of my best friends from high school had an aneurysm and actually coded for a short period of time, but amazingly she made it through and has no deficits now, and is she's an English teacher at the college level. So. But many times people who have aneurysms will be left with other types of residual problems like memory deficits primarily, or maybe visual deficits if it's more in the posterior regions. And this is just kind of a rough diagram of the Circle of Willis It sort of looks like a spider in a way, and so if you want to call Willis the spider, that's just another mnemonic for kind of what the circle of Willis looks like. You can just see the pons here, and this is where the vertebral arteries kind of fuse, and they form that basal artery that then gives rise to the posterior communicating artery. All right, so that's just kind of an overview of the vasculature of the brain, and I think, you know, at minimum, some of the smaller blood vessels I wouldn't expect you to know, but I would kind of expect you to know things like what arteries, what's the name of the arteries that supply the brain with blood, and where does the basilar artery arise from, you know, over the pons, and you know, what parts of the brain do each of the anterior, middle, and posterior cerebral arteries serve, things of that nature.